All right, today we're putting artificial intelligence on the examination table for a full health checkup. We're going to answer a really critical question. When it comes to your health, can you actually trust Dr. AI?
So think about this for a second. Let's say you just got some serious medical news. Your first thought might be to jump on Google. But what about its super smart new cousin, AI? Would you actually turn to a chatbot for answers? Well, it's a question that researchers are taking very, very seriously.
And to really get why this all matters, let's ground this in a real-world problem, one that's faced by a very specific group of patients.
You see, for people who are battling head and neck cancer, getting clear, trustworthy information isn't just a nice-to-have, it's an absolutely critical part of their treatment and their quality of life. After they talk to their doctors, the internet is almost always the next place they go looking for answers.
And the things they're trying to understand are incredibly serious. We're not talking about minor issues here. There's xerostomia, which is a really severe dry mouth, mucositis, which causes painful sores in your mouth, and even something called osteoradionecrosis, where bone tissue can actually die. When you're facing challenges like these, it's no surprise that patients are looking everywhere they can for guidance, and that now includes AI.
So that's exactly why a recent study decided, okay, let's put these AIs to the test. We need to see if they're a genuinely helpful resource or, a potential hazard.
So how'd they do it? Well, the method was pretty straightforward. First, the researchers gathered 40 of the most common questions these specific patients ask. Then, they took those questions and posed them to 8 of the big-name AI models. You know the ones, like ChatGPT and Gemini. And finally, they graded every single answer using what they called an AI report card.
So what was on this report card? Well, they used a bunch of established scoring systems to grade the AI on 5 key things. First, reliability. Was the information actually trustworthy? Then, understandability and actionability. Was the advice easy to understand? And, this is a big one, did it actually tell you what you should do? Finally, they looked at readability. Was the language simple enough? And of course, they checked for any straight-up misinformation.
All right, the results are in. Let's open up the AI's final report card and see what the grades are.
The big picture result was this kind of split personality. On one hand, the AIs were great at giving out information that was easy to understand and factually reliable. But on the other hand, they totally stumbled when it came to giving clear, actionable steps or just using simple language.
So let's talk about where it got an A+. The median score for understandability was over 75%. That's fantastic. It means that patients could easily grasp what the AI was explaining to them.
But, and this is a huge but, here's the failing grade. The median score for actionability was 40% or even lower. So the AI could explain a problem perfectly, but it completely failed to tell you what to do about it. It was like reading a textbook that describes a fire in great detail, but gives you 0 clues on how to find the exit.
And that really gets to the heart of why it failed. The study authors themselves put it perfectly. These AI models are built to deliver information, not concrete recommendations. They can give you facts, but they will not give you a plan.
So, what's really going on under the hood here? Why is AI so good at one thing and just so bad at the other?
This chart right here, it tells the whole story in one picture. Seriously, it maps out how all 8 of the AIs performed. First, just look at the top right, at understandability. See how all those lines stretch way out to the edge? Those are great scores. Now look down at the bottom right, at actionability. Whoa, all the lines just collapse in towards the middle. It's the clearest picture you could ask for of a system that can talk your ear off but can't actually guide you.
Which brings us right back to that million-dollar question. Why is there this massive gap in performance?
And here's the twist. This isn't a bug, it's a feature. These AI models are deliberately designed this way. They're meant to be informants, not doctors. Because of massive liability concerns, they are literally programmed to avoid giving direct, explicit medical advice. Their safety training makes them super cautious, so they stick to general, risk-free answers. They're basically just summarizing a giant library of information, not applying that information to you.
So, knowing all of this, how should we think about the role of AI in our health as we move forward? What are the next steps?
Let's circle all the way back to our original question, but this time we've got a lot more data to work with. So, should you really trust Dr. AI?
Well, the study gives us a very clear prescription for how to use it. First, use AI for learning, not for acting. Think of it as the world's most incredible encyclopedia, but it is not your personal doctor. Second, and this is huge, its advice is absolutely not a substitute for professional medical care.
And third, and most importantly, always, always, always discuss what you learn from an AI with your actual human doctor.
So in the end, the real takeaway here isn't some sci-fi story about AI replacing our doctors. The future is all about doctors and patients figuring out how to use these incredibly powerful tools wisely as a supplement to and never ever a replacement for real human expertise and care.